thank you very much. It's nice to be here. I'm just turning on the microphone because I might wander. So can people hear me okay? Wonderful. I'm sorry? It's okay. Oh, okay. I hear some things and I hear people say don't pay attention. Uh, First of all, I'd like to say thank you so much for having me. I have already gotten some nice welcomes from people and look around and see some familiar faces. So I'm so grateful. My husband does a fair number of these talks. So when Jim McDonald called one morning, I was busy thinking, oh, how am I going to tell him my husband's too busy? And then he said, oh, it turned out he wanted me. So I want to thank you for contributing to equality in our marriage. This is what I thought we might have a general discussion on, talk just a little bit about local medical charities, and then basically sort of segue into a little bit of a travelogue on Thailand. I'm not an expert, but did go there earlier this year, have questions, and then after a little break, we're very lucky to have John McConville, who's the executive director of the Salem Free Clinic, and he'll tell you about the Free Clinic, which is a lovely resource. We'll have questions, and everyone will be able to go home by 3:30. So actually, it was interesting. I came to Salem a little after Jim did, so I didn't know about the lack of resources in our community. But I do know that even up to about 10 years ago, if someone in the community was uninsured or low income, there were almost no resources. They couldn't really see anyone until in an emergency situation there was the Salem Hospital as a fallback. In the past 10 years, it's been nice. There's really been more awareness of the problem, but also organizations have really stepped up to the plate. So now I'm kind of proud of what we do here in our city. I don't have a lot of firsthand knowledge about all of these organizations, but I am aware of them, and I just wanted to make you aware of the breadth of what we have. The first one is the Salem Free Clinic. This is all volunteer providers who volunteer anywhere from once a week to once a month, and I'm not going to talk any more about that because John's going to. The next three are considered federally qualified community health centers. And these are programs whereby people who are of low income can come in, and it's not free. They do have to pay, but it is based on their ability to pay. These all are staffed by paid providers. They all accept insurance, and they do have access issues from time to time. Patients may want to get in, and there just isn't a space available. It would be really silly to talk about medical charity in Salem without talking about Salem Hospital. I just got this off of their website because I don't have any special ins to Salem Hospital. But according to their website, they gave $104 million in charity care. Now, some of this number, from what I could figure out, is they're including the amount the difference between what Medicare pays them versus what they charge. So I don't know if you can call that all charity. However, $41 million was really charity care and unmet costs. And the truth is, for volunteers at the Free Clinic, they've really been wonderful to the Free Clinic. They, almost all of our patients, if they need labs or imaging, we don't have any of that at the clinic. They go to the hospital, and if they qualify based on income, which almost everyone does, then everything is free to them. So it's really a huge service, since we really can't practice medicine here without knowing a few labs or getting a few imaging studies. So if patients are uninsured here, they can get into care now, as long as they know about the programs. But in addition to having a provider, it's important for patients to be able to get into specialists or to afford the medicines. I'm sure some of you have been reading about the EpiPens. And as you know, the insurance or the drug companies charge as much as they can, and it's really out of the range of affordability for many, many people. So we have a couple of programs, and these programs have been sponsored by the Medical Foundation of Marion-Polk County, and this is really, their main sponsor is the Marion-Polk County Medical Society. So anyone can donate. A lot of these programs really are sort of sponsored by the healthcare community. One of the programs is Project Access. This is a great program because all of the other programs like the Free Clinic and West Salem Clinic, these are all primary care providers or volunteers like me who, when I go to the Free Clinic, I do primary care. But the problem is if someone comes in with an orthopedic problem or a cancer or a urologic problem, I mean, they just see whoever is available. And I am an allergist, so I'm not much help in those situations. So Project Access has some paid staff, and what we do at the Free Clinic is if we think someone needs a specialist, and if that class of specialty is volunteered to see people, then we can fill out a form, and they end up, and the specialist will see them for a 6-month period of time, or sort of through a problem in their clinic. And it's really been wonderful. I remember early on, I had one woman who had blood in her urine, and it turned out it was renal cancer. I referred her to Project Access, and I was getting notes from the neurologists years later, and so her cancer was removed, and really her life was saved because of this program. I've had other patients, same thing, where they get to specialty care. They may need a surgery, and obviously we can't do any sort of surgery at the Free Clinic. So we can refer them, and through this program they can get the care they need. It's not perfect. It is volunteer, and unfortunately not all specialties are volunteered, so sometimes we're scratching our heads. But it's a huge help. Another program is Women's Health Care. This used to be run through the YWCA, but I think they just ran out of money. So, and if anyone knows otherwise, please let me know. But at any rate, it has been taken over by the Marion Pope Medical Foundation. It provides mammograms to women who qualify. And also if a woman feels a lump, and if there's money in the budget, it sees the woman through, not just through the mammogram, but sends them to someone who can then biopsy the lump and follow through to the conclusion of whether it's benign or if there's a cancer, follow through on that. The third program is Medicist. This is a very lovely program too. Like I was saying, the medicines unfortunately are not, many of them are not cheap. At these low-income clinics, we use the $4 prescription plans as much as possible. And you can do that for many blood pressure medicines, for many cholesterol medicines, for quite a few medicines. But some medicines, there's no generics. For example, most inhalers for asthma or COPD, lung disease, there are no generics, and these are hundreds of dollars. And insulin also is not on any sort of $4 prescription plan. It's very expensive and, of course, crucial. So the forms, there are pharmaceutical programs to let people get these for free. However, they don't make it easy on you. The forms are very, very cumbersome. With Medicist, there are volunteers who are skilled at filling out these forms. They take information from the patient, they fill them out, they send it to the physician, so all we need to do is sign it and give a prescription. They take care of sending it to the company, getting the medicine back. It takes about 6 weeks for people to get their medicines. And just recently, the Free Clinic has also begun to access another charity pharmacy that's not local, so I'm not mentioning it. But all in all, our healthcare, I've always liked healthcare, and I've liked being in this profession because it's almost everyone in this profession really does it because they want to help other people. And so it's really nice to have organized ways to be able to do so. So the people in our community through the years have cared about not just our local population, but about other populations. This is a short list of some of the programs that have been started or operated by local physicians. I'm not involved in the first 3, and I'm sure there are others I don't know about, but you might hear of them from time to time. I just wanted to give you a taste of what physicians are doing. The first one is called Capital City Medical Teams, and this was started by an orthopedist in town, David Shaw, and it involves generally surgeons and surgical nurses, all volunteer going to a place in Central America for a week every 6 months or so, and they do surgeries. They do generally orthopedic surgeries, or I know one ENT physician who did a lot of cleft palate repairs. So really life-changing surgeries for these people. A second helpful physician is Dr. James Lace. He's a prominent pediatrician in town, and he, on his own, really, has been sponsoring an orphanage in Tanzania. And he has started a couple of foundations to help raise funds. He goes there every so often, does exams, but he also provides their financial support. Dr. Desiu is a family practice physician in Staten, and he is from Haiti. After the earthquake, he felt called to go back, and he's been going back yearly with a team of local physicians and nurses to provide medical care and other aid there. So the group I was involved with is actually from Salem Alliance Church, and this is a group that does medical missions periodically, and one area they've been involved with for a number of years is Thailand. They've actually been going to Thailand probably for 15 years or so. This was my first time. They don't go every year. They go every 2 or 3 years for about a month because they're all working physicians, and so you really can't take more time than that off every so often. I actually don't go to this church. I go to the Methodist church down the street, but one of the nurse practitioners knew I was retiring, and so she ran in my office one day and she said, "Laura, we think you'd be a great fit." I actually this had always been one of the things I wanted to do, is do a medical mission. I hope to do more, and I thought this would be kind of a nice one. I'd looked into Doctors Without Borders and Medical Teams International. They all required very long commitments of 6 to 9 months, and I like my husband enough that wasn't going to work. So this was a short term with local people. We have things in common, even if I didn't know them well, and it worked out very well. So I'm going to just, first of all, I'd just like to ask, because I am not a Thailand expert. I am not really, I've traveled a little to Europe, but not much. So this was my first time, other than to Mexico, to a third world country. How many of you have been to Thailand? Oh my goodness, so this is kind of silly. So, but at any rate, so at the end you can chime in with with your insights on Thailand, because clearly this group knows way more than me. What we did is we flew to Bangkok, and again, as many of you know, this was a long trip. It was an hour to Seattle, 12 hours to Seoul, Korea, 6 hours to Bangkok, and then we got there about midnight, and it must have been 90, 95 degrees, and it was humid, and it was just so crowded, and we were completely wiped out. We spent a few days in Bangkok packing pills and basically getting over jet lag, and then we drove in vans up to a town on the border with Myanmar called Mae Sot. We spent about a week there going to little villages, and these villages are mostly Hmong villages, and they're not on any maps. And they're the hill tribes of Thailand. We then spent another week. We moved over to Tak, and we also went to the hill tribe, to little villages there. And in each of these spots, we spent a night or two in the villages when they were remote. If they were within driving distance, we would stay in the bigger town because it was more comfortable. We then went up to Chiang Mai, and we went to a village there. We went to we did a clinic in a facility that helps children who are at risk for being sold into the sex trade. Flew back down to Bangkok, and then flew home. So this is our group. This is Tom. You may know some of these people. This is Tom Flaming. He's a family practice physician in Dallas. Shelley West works at Willamette ENT. She's a nurse. Jennifer Lee is a nurse practitioner at Salem Clinic. Bob Gethart, I believe he's Associate Director of Oregon State Hospital. Susan White was the trip coordinator. Lori Heineman is a nurse over at Hope Orthopedics. There's me. And there's Cheryl Lebrone, who's a nurse at Salem Hematology Oncology. So we actually cover quite a broad range of things. This is typical countryside. Again, the big thing is it's so hot, it's so humid. And the other thing that at least was a surprise to me was the air quality was quite awful most of the time. There were fires everywhere. I mean, the tribes would do a lot of field burning, and they also would, at night, everyone had a fire outside, and just driving along the side of the road, there'd just be bonfires everywhere, and of course the mopeds and the pickups, and I don't think there was much emission control. So I actually didn't take many landscape pictures because it was hazy all the time. I also thought that I would talk more about our time in the tribes and not really talk about Bangkok or the typical tourist areas, but try to show you some of the places that were touristy. So I looked at your directory and I saw like you learned about dengue fever this morning and you have lots of complicated things, but yet, so I feel a little silly showing you this, but I have to say this was a shock to me and I had to be shown how to use it. So I don't know what their fancy name is. We call them squat pots. And this is what we use. If you want toilet paper, bring your own, and you just, when you're done, you just take the little plastic bowl and you scoop it up the water there and pour it down until it manually flushes. So this is what we used. This was actually at a very sophisticated rest stop on our way up to the villages, and they had sinks outside. But so when I was washing my hands afterwards, I noticed that the liquid soap, actually in English, it was shampoo. But my hands felt very shiny and very manageable, so that was good. This is our first stop in the first village. This was called Meklong Yai, and we're just getting our bearings, and these are the vans we traveled in. We had a couple of drivers and interpreters, and I'll show you that in a second. This is the village store. I should say that these villages, sometimes you would see wires for electricity, but they're very remote, very primitive, and I never actually saw any evidence of electricity other than sometimes going by the houses you might see just one solar cell about this size. It would go inside the house and be hooked up to a battery, and that would be enough to power one light for a few hours, from what we were told. I saw satellite dishes, but never saw them actually being used except by the stores, and my guess is they really just couldn't quite get them powered enough to work. The baskets were very typical. Another view of the store, and the store, as you can see, there's fabric because the women sew all their own clothes, boots for the rice paddies, and this was pretty typical store. They just sold the crops that they had in the field, no refrigeration, and again, no electricity in the store. This was a very typical house. This was actually one of the nicer houses. It was quite common to maybe see pumpkins underneath. They would use the pumpkins for their food, or maybe a big old bunch of bananas. When we first walked in to that first village, this is what we saw. A couple of women busy sorting corn. This was actually feed corn for their pigs that were roaming around. And she had a child on her back, and you saw that all the time. I have several pictures because lots of times they were awfully cute. This was the first church we went to, and this was a new church. It had been built since the last time the team had come. Half of us were new to this trip and half had been here before. And you can see, again, it's hilly, but it's not like the Santiam Pass hilly. It's just kind of these gentle hills, and quite pretty though, and quite lush. As you looked from the porch off to your left from the church, this is what you saw. And here's a close-up. Remember, it was 90 degrees, 95 degrees, and yet it always amazed me at how she can dress up so much. The other interesting thing is that the Hmong really don't seem to drink much water. She didn't have any sort of water with her. We had water bottles with us all the time, and they would wait for hours for these clinics without any water. I actually asked one of the Hmong missionaries how, I sort of commented on that. She said, yeah, when they were growing up, they never did drink water. And so they just must be acclimated to it so much more than we are. The other thing is some of their spices are so hot. I don't know how they do it, but they manage just fine. But she did point out that they have sort of a soup as some of their main dishes. So they do get liquid with their meals with soup. They just don't sort of drink separately. This was our first clinic, and I'm going to spend a little time on this slide just telling you what we did. Sorry, it's kind of hazy or blurry, but it is really my best picture of the clinics. We each got one carry-on to go over, and then our second bag was about a 50-pound bag that had group supplies for the clinics. And in them we packed the tablecloths, hand sanitizers, glucometers, lots and lots of medicines, wound supplies, and everything that we thought we might need. We just sat at these tables. We were generally kind of interesting in the town. They didn't see a lot of, I mean, I don't think they ever saw anyone. So we were definitely something that the villagers would come and see a lot. And so they would have their different problems, and they would come in, and we would greet them. There would be one person at the front door, and then just as people's numbers came up, we would come and get them and talk to them. Everyone was given albendazole, which is a medicine for parasites. And you might wonder, well, what good does it do to do it once? I actually don't know much about tropical medicine, so I was reading about this before we went, and it turns out that if people are dewormed periodically, the children, they do have a much better growth rate. They get better nutrition. So even doing it once in a while is worth it. And I had also been worried because I had no idea how to tell who needed to have medicine for parasites or not. And so it turns out this group had been through that and just did it to everyone. And that was good. But sometimes they'll tell you, they'll say, I need worm medicine because they see worms in their stools. It was very difficult to get the gist sometimes of what the problems were. There were us, and then we had a couple of interpreters who spoke English and Hmong. So if it was our lucky day, we got one of those interpreters. We didn't have enough of those interpreters, so we brought along with us some people who were English to Thai interpreters, and then from the villages, generally there were a couple of people in the village who could speak both Hmong and Thai, so we would borrow them. However, so then I might ask someone a medical question, and then the person who spoke Thai would translate it to Thai, and then the Thai Hmong translator would translate it to Hmong. That person would ask the patient. There are lots of cultural differences and a completely different understanding of time and of how medicines are taken. So there's that cultural difference. Then that person would answer back to the first interpreter, who would answer to the second interpreter, who would tell me. So frankly, sometimes I actually forgot my question. And I'd have to ask the interpreter, what did I ask? But even so, it was very much like a game of telephone. In terms of the medical problems, we just did very basic medical care. It was very interesting what you saw. You saw an awful lot of aches and pains. Everyone there really works in the fields, and unfortunately, there's no retirement. They just work in the fields until they really can't anymore. So there's a lot of aches and pains. We saw a lot of eye issues. I hadn't really expected that, but they don't wear sunglasses. They're in the dust, and so a lot of them have pterygium, little growths in their eyes, and very dry eyes. A lot of stomach issues. Let's see, and we did have antibiotics, and some children especially needed them, but probably not as much need for antibiotics as I might have realized, or as I might have thought beforehand. Also, there were some, I was reading, and I'll show you a book about this later on, but the Hmong don't necessarily separate between physical problems and mental problems. So if they're distressed emotionally about something, they may just not feel well physically, not be able to describe it, but their issue may not have a physical basis. And so it's a little hard to tease that out. But we did see that, where you're feeling like that's what's going on. And for them, really, you can just offer a little bit of support. We also saw some older people, and there's not a lot of aid or assistance. So if people were lucky, their children would bring them in. I saw one older woman. I'm guessing she was in her 80s, but of course she doesn't know, and I don't know. And her husband was still alive. He was older than she was, and he was bedridden at home. She was caring for him. She had 3 children, and 2 had gone to the States, and they sent her back $200 a year. She had 1 daughter, but the daughter was married in another village, so the daughter wasn't able, sent her a little rice, but was not able to really care for her. And her chief complaint was she couldn't see anymore to separate out the rice from the little pebbles that were in the rice. And you just feel for her. She really didn't have anyone to care for her. She needed that. And I gave her money. I didn't know what else to do, because we actually gave everyone who needed them eyeglasses, reading glasses. She had cataracts, and so we gave her glasses, but honestly, I don't think they're probably going to help her issue. But you want to give her whatever you can. These are just a group of the Hmong women just waiting, and they would wait there all morning and talk. And one lovely old woman, and she walked so slowly, just with a cane in each hand, but she did make it up there. Some of our group actually spent the night in that little shed in the back. It was so dark, I chose to sleep in the church. This was a very typical meal. This was, and generally the administrator for the group had paid the tribes people to buy food for us to cook for our meals. I got pretty sick of Thai food at the end of the trip because it wasn't like our Thai food here. So there were bowls in here, and one big problem is that they were washed in the stream water, and it was definitely not boiling water. And there would be still some water on there you could see. So we would try to use Lysol when we can, but the truth is all of us got sick at some point during the trip. And then they don't use chopsticks, which surprised me, just little spoons, a big pot of rice, a pot of broth, and it wasn't really curry, just broth with greens from the fields and mystery meat. Though one time I scooped up some of the broth from my rice, and there was this great big claw just looking at me. So I decided to just have rice for that lunch. And there was watermelon there. And you didn't always have watermelon, but sometimes. This was a lovely young woman who I saw with her baby on the back. They just carry their children all the time until the children really are old enough to walk. She was 21, and this was her second child. She'd been married for several years. The women there had a very hard life. They don't have a lot of status. There's polygamy there. So second wives and third wives have almost no status. There was a situation where we saw a second wife who was seeing us, and her children were there, and they were about 8 and 10 or so. The husband had already died, and she wanted to go off and remarry someone else. But the first wife had told her that if she did that, she had to leave her children with the first wife to help in the fields. So she had to decide whether to help in the, to stay with her first children or with her children or get remarried, because she was not able to participate in that decision. There also is spousal abuse, and that's a problem as well. And I had lots and lots of women tell me they wanted to do something, but their husband wouldn't let them. I had another woman whose husband had died, and she had wanted to move to a different village, but they believe in spirits there, and her husband's spirit was telling her that he was going to put a curse on her if she moved. So you have lots of these beliefs that make it very hard to try to counsel them other than try to give some reassurance. Another beautiful young child with the traditional Hmong gear. And this is how they kept their chickens and roosters. Some of them, and I don't know how they chose, because lots of them ran free, and so in the villages all over were the chickens and the pigs and the dogs just running everywhere. The dogs were different from here. They were just mangy, and they didn't kill them, but they didn't take care of them. They weren't pets, and so these poor dogs were just malnourished, and they just kind of lay there and look at you. This was a very typical courtyard. We had lunch in several courtyards like this. You can tell there's no landscaping. I guess at least they didn't need to mow the lawn. And but this is kind of funny, I think. So it's wood and just a metal or thatched roof. And if you can see that little red thing there, so it's a satellite dish. This is the road going out from the village. And it was interesting, even after dark, you would just see the headlights coming in on their little motorbikes or on the tractors for a couple of hours. We were told that the fields for this village extended out. A couple of people would travel 2 hours to go out to their fields in the beginning of the day, and up to 2 hours to come back. These were dirt roads, very bumpy, and they must have accidents from time to time. And they obviously worked very, very hard. Just another church, more Hmong waiting at the church, some sugarcane drying, and a more typical hillside. This is another home we saw, and I don't know if you can tell, there's a little child there. I don't, honestly, we were there in what was called the hot season. A Thai person told me they have 3 seasons there: hot, hotter, and rainy. And I don't know how a home like this manages during the rainy season, honestly. So again, the degree of poverty is just kind of unbelievable. This is the inside of one of their homes, and here they are, they're cooking us lunch. It's kind of hazy because it was dark. They use indoor stoves to cook on, or indoor fire. So the huts are incredibly smoky. And they have a grate on the stove, and then they'll have a couple of pots, one for rice and one for their broth or their curry. They'll have a little room off to the side with mats on it where they sleep. There's no furniture. They usually have a couple of wooden shelves for their supplies. But this is it. Very, very, very basic. Here's another woman just busy helping prepare the meal. And lovely children. Again, while we were busy doing the clinic, one of the van drivers liked children, and so he just stayed there and played with them, and he taught them a little nursery rhyme, so when we were off for lunch, they sang it to us and they danced around and were very lovely. This was a little hobby of mine. Not a hobby, but it was interesting to me. My husband actually worked on the music for the movie Frozen. And so here we are in this remote village, no electricity, dirt floor, just rare wooden shed, and yet hanging on the clothesline is a sweatshirt with Elsa on it from the movie Frozen. You cannot imagine in Disney's marketing ability there, because in some of these remote shopping centers, there was a whole store with shirts, and about half of them were Frozen. And in the grocery store, not in the little villages, but in the bigger ones, they would have Kellogg's Olaf cereal, so it was kind of amazing. This is the little girl that owned that sweatshirt. We went to one village which had several tribes all in one village. The Thai government had put them there. So this was a Doi Musu tribe, and they have a different outfit. I don't know if you can tell this hat. I'm not sure where this woman got this hat, because this can't have been part of the costume, because these were wings, felt wings on her hat, but she loved that costume, and it even kind of matched. The Hmong people have a very different sense of privacy than we do. They didn't sign any HIPAA forms. We would often do our clinics just in the church, and so we'd be at a little table, and you just would turn your head, and 3 feet from you, there were a lot of windows there for ventilation, and there would be a whole row of people just looking at you and seeing what you're doing. And sometimes they were children, but sometimes not. So they just liked to see what was going on, and none of the villagers seemed to mind very much. They grow strawberries there. They have other things in their open markets. They had rice drying on mats on the ground with the dogs sniffing all around, and they had skinned pig's head. But because of the strawberries we grow, this interested me. This was the home of this woman right here and her husband. It was a little bit nicer home. It's cinder block, still no furniture. She actually had been a cook for them on previous expeditions and didn't go this time. However, she invited us to her house for lunch. And as you stepped out our front door, this is what you saw. And I'm sure there were 2 less chickens there than there had been a couple of hours before. But they did taste better than most of the food. For one of the villages, we were in a very small pickup like this because the vans were not able to maneuver the road. So you can tell we had to really cover up, and I just thought we looked kind of crazy. But this is how the workers look in Thailand. They've got the head coverings, and we had sunglasses, and that was one bumpy ride. More hillside, and again, they'll farm it as far as they can. The Hmong people seem to have fairly porous borders. This gentleman was one of the village elders, and he was actually Burmese. And we also talked to a lot of Hmong villagers who were from Laos originally. It still was a little bit of a problem for them in that some of the Thai villagers did have access to medical care, not in the villages. They might have to drive a couple of hours, but if they were from other villages, they had no access at all. This was church, and after church, we then had a clinic in the same spot. This was their main community gathering. You can tell, according to our standards, it's really pretty filthy. Again, as I was seeing patients, you're busy shooing away chickens and dogs, and you can see just a lot of junk and trash there. At this clinic, one man brought his father to see me, and he just carried him in. I'm guessing, again, his father might have been in his 70s or 80s, and they have no wheelchairs. So he just carried him into me. And this poor man, I'm almost positive, must have had some sort of cancer and was busy wasting away. The chief complaint was that he had been losing weight. For 6 months, he hadn't been able to eat. He didn't have good breath sounds in his lungs, and I really just had to tell them I wasn't sure that medicine was going to be able to help him. But it was, you know, you just have to sort of make this assessment, figure it out, and tell him in the space of 20 minutes. And that was kind of tough to do. Again, we had a crowd, and a mother and her child. Another mother with her child, and with this beautifully embroidered carrier. This is a gas station. They have a lot of motorbikes and some small pickups, no cars. There's the gas station. It's not quite like Shell. And there's their mini mart. Here's another young girl, and there's a crowd of about 10 children. The children, as soon as they get old to walk, the older children watch the younger children, and they just hang out in the village all day. And so her job was clearly to take care of her baby brother, and she just carried him all day without complaining at all. And she also happens to be wearing an Elsa shirt. These are very common tractors that they would ride in to go off to the field. You see them full of the workers. Off they go. This was at a school. It was nicer than any of the other buildings in town and looked to me like it had been built by the Thai government. The one interesting thing is, so the girls are busy sweeping the steps. Off over in this area to our right is a big field. And so while the girls are sweeping, the boys are busy playing soccer. This was another community center, and as you can tell, their exam table and their scale, it's seen better days. They had a little shelf at this center with some medicines, though I didn't use them. One was brown mixture. I don't know what brown mixture is, but I didn't think I was going to try it. Here's another one, and you can see in English it's called de gas, against flatulence and meteorism. I actually don't remember ever learning about meteorism in medical school, so if any of you know, let me know. Very typical countryside, and again, more hillside. This was one of the last villages. This was a beautiful village. In the US, it would have been $1 million view. And the elder at this town was more organized, and she must have given the people an ultimatum to come, but they're coming, and they're all in their beautiful, beautiful embroidered shirts, which is lovely. I have to tell you at the stop before this, these chairs were universal, and lots of them had the Coca-Cola logo on them. They weren't very sturdy. And Tom Flaming, who is bigger than most Thai people, but he's not excessively big, but he broke 4 of those in one 12-hour period just by sitting on them. This was one of the sadder parts of our trip. We actually were asked by one of the villagers to go see to the hospital. You can see there's a Buddhist monk coming out. There was a Buddhist shrine and crematorium attached to the hospital. This villager had been driving his pickup after dark and had passed at a bad time. The roads there are treacherous, and had been the cause of a head-on collision. He was worried because he had to pay a fine to the other occupants and did not know how he would pay that. And I was told by the missionary there that there was a good chance he would have to go to jail if he couldn't pay it. But even sadder is that his 20-year-old cousin was in the back of the pickup, and when he was sleeping. And so when there was the collision occurred, he was thrown over the pickup, and his spinal cord was injured, and he was paraplegic. So he was at this hospital, and they asked us to go visit him. The emergency room was just crazy. This is the intensive care unit. And he is in a bed off to our right, and I didn't take a picture of him because that just didn't seem right to me to take a picture of his misery. But the ICU was interesting. The nurses there are doing basic care. They did have IVs in the patients. They're wearing their, I haven't seen a nurse in the United States wear their hat in, I think, ever, but they like uniforms. This poor young man was just emaciated. He had a tube, and he was getting tube feedings, but he clearly wasn't able to absorb them. They had done good basic care. He had a tracheostomy in. His spine had been stabilized, but he clearly was immobilized. He was 20, and his 16-year-old bride was there, and she just looked shell-shocked. His mother was there too, and so On the other side there were must have been 3 or 4 beds on each side, with just a wall of sliding glass and then an aisle. It was concrete, open to the outside, and this is clearly where his family was staying. They had mats and food out there. He had been told that he could be discharged because they couldn't do anything more for him. So far, the family had refused because, you know, when you see these villages, you can see there's no rehab facility for him to go to, and he can't manage in one of those villages. There's no wheelchairs and there's no wheelchair accessibility. He's not going to be able to do crops, and I'm afraid he has a very bad prognosis, but I just felt terrible seeing it. That was actually the end of Thailand. I'm just going to show you a few slides of Burma or Myanmar. It was very interesting. We just did this for an afternoon when we were in the border town. And this is crossing over into Burma. This is the crossing, and I'll tell you, it was kind of surreal. They separated the Thai from the Americans. So we were in one little room, and we, of course, don't speak Burmese, and they don't speak English. And they're taking our passports and money. And They give it back later, but you know we don't know this because they're not telling us. And at the same time, it was Chinese New Year, so they had a dragon. They had a parade going on right outside. So there's the big dragon right outside the window. There are the huge drums going. Everyone's crossing. A lot of the Burmese come into Thailand for work, and it was really a very surreal experience. One of the missionaries told me, she said that that the ethnic Thai looked down on the Hmong and the Laotians, but the Hmong looked down, everyone looks down on the Burmese. So unfortunately, there's a big caste system everywhere. This is just, I thought, these monks were just sitting on the side of the road. I just thought that was a lovely picture. A vendor. This was their market. The Burmese women wear face powder, and the children have it too, and you might not be able to see it very well, but you can actually see the powder for sale in the markets. And these hats were typical of the Burmese. That's how the Thai could tell if someone was from Myanmar or not. This was the most stomach-turning part of the whole trip. Do you see a refrigerator anywhere? I don't. And just skinning it, and they're barefoot, and they're just squatting there among their wares. And the smell was just unbelievable. And I didn't touch anything, but yet that's the night I got very sick. This is a very interesting book, and I have it here. And actually, it was written about 10 years ago. It's called The Spirit Catches You and You Fall Down. And if any of you are interested, it's a good book. And if you come up, I can show it to you or give you the name. And it was written by an American reporter about the Hmong community and a Hmong family actually in Sacramento with a very sick child. And it just talks about the culture clashes of these Hmong villagers and their belief systems and how they really don't coincide with Western medicine very well at all. But it was interesting, and it helped me to understand a little bit of the difficulties we had too. And I'm just going to finish with some beautiful poinsettias. The poinsettias grow wild there. Just a Buddha. Thailand is Buddhist. The Hmong themselves, some are Buddhist, some are just sort of spirit animist, and some have converted to Christianity. And then I'm just going to finish with this picture I took of an old woman just waiting there for her turn very peacefully. So that's it. And does anyone have any questions? Oh. Oh. Sure.
I'm Vernell,
Hi.
and I don't have a question, just a comment. Your juxtaposition of Salem's medical care and the medical care there is just amazing.
It's pretty amazing, isn't
and
it?
it makes
Pretty
me
unbelievable.
thankful for a Band-Aid.
I'll tell you.
Thank you.
Thank you. You really appreciate what you have when you go to places like that.
Hi, this is Cassia. To what extent, if you know, does the Thai government provide these medical clinics or medical teams into the hillside country for the Hmong,
So
if any?
that's actually kind of interesting. They do provide some, only to people who have a Thai citizenship card, and it depends on the village. They do have some Thai community centers, and actually, and not all the villages have them. In one village, I saw a gentleman, and his blood sugar was over 400. For those of you who know, this is not good. We didn't actually have any diabetic supplies. And so all I did was I asked him, how far for you to drive to a clinic where you can see someone to get on medicine. And it was 2 hours away, he said. And I gave him the money to get into the clinic. And then they actually are charged a relatively low fee of really a couple of dollars to be seen. But the clinics are not always available. Again, they're not in the villages, so they have to get there. They seem to have a tradition of not taking medicines regularly. So things like diabetes and high blood pressure, they're not, sometimes we would see people that would know they have it, but really no concept of needing to take medicines on a daily basis at all. And the hospital, I believe, if they're in the hospital, they get that care all for a low price. If they're refugees from Burma or Laos, they get no help at all. The other thing is in some of these community centers, like in one of them, there was a community center there. So someone came there maybe every couple of weeks or so, and he actually happened to be there when we were there, and he came and talked to us. But he wasn't a physician or even a nurse. He had had a little bit of training, and it sounded like he knew how to give vaccinations. He wasn't a very skilled medical provider. So they have a little basic care, but it's not extensive.
Kathy, I was noticing there's stitchery. Are these Hmong related to the Hmong that we brought here from when we were fighting in Vietnam?
Yes, they're the same.
They're the same, okay.
Yeah, yeah. It's interesting about the stitchery. Again, we provided reading glasses, and it was interesting. No one had reading glasses there, but the women, when they were trying to figure out what strength they wanted, we would read something, and they all brought their stitchery, and they were trying to see which glasses made it easier for them to do their embroidery. Yeah, and we actually visited there are a couple of Hmong churches in Salem, or way out, kind of near Turner. And we actually went to one Sunday before we went here. They gave us some Hmong things to take to the Hmong villages. So, yeah.
Well, why don't we take our break then?
Hey,
We'll
that
be
sounds
back in
great,
about
and then
10
John
minutes then.
Thank you.
Thank you, Laura, for the nice introduction, and thank you for your service at Salem Free Clinics. Without our volunteer providers, we don't have a clinic, and then we can't help people, so thank you. My background a little bit is I'm born and raised in Salem. You might know some of the McConvilles. My uncle was Judge Bob McConville. My dad went to Willamette for a couple years until he got drafted into the Korean War. After high school here, we lived out in Kaiser, went to McNary, and then I graduated from the University of Oregon in 1980 with a degree in health education and public health. And then I kind of took a side turn out of the healthcare arena and ran my own business for 30 plus years. And almost 4 years ago, I sold the business and retired at a fairly young age, I guess. And as soon as I retired that same week, I started volunteering at Salem Free Clinics because I had always been interested in the work of the clinic and a little bit of a healthcare background, and was just started volunteering there and found out right away there was a good fit, great people to serve with, and it was, you could just tell right away that it was the right place to be, so I really enjoy it. I was volunteering there for a year or more, and a part-time staff position came available, and I'm like, well, sure. They asked me to do it, and I said, sure, I love this place, anything to help the clinic. And then there was an opportunity to be the coordinator for the Polk Community Clinic in Dallas. And I said, sure, love to do it, love this place, And then all of a sudden, one day, the board president and the executive director, Todd Gould, came to me, and Todd was one of the founders of the clinic 11 years ago. And they says, well, Todd says, I'm moving to Bend. I've got a job over there and I'm getting married, and this is my last day. Can you start Monday as the interim executive director? And I'm like, you got to be kidding me. So all of a sudden I'm out of retirement, back into full-time work, but I wouldn't have gone back into the real world and worked again. But this is not work. This is just service, and it's a ministry, and just really enjoy it. I mean, I get up every day and I'm happy that I can go to such an enjoyable job. Work with 400 and some volunteers that are people, some people of faith, some people of just goodwill. They just want to help people in the community. So it's a really great place to be. Normally I would have questions coming at me all the time, and I kind of am good with that, but I see that this format is more, we have questions at the end, so I guess go ahead and hold your questions at the end, and love to interact and answer questions at any point there at the end. So I mentioned Salem Free Clinic started about 11 years ago. Started out very humbly. West Salem Foursquare Church, they did a little bit of a survey. They had some outreach pastor at the church was interested in seeing what was needed in the community. And they went out and surveyed the area around Walker School in West Salem, and they thought, well, maybe there's going to be, food needs, employment needs, whatever it was, shelter needs. The number one thing that came up, access to health care. They're like, oh, darn, that's not simple. Running a free clinic, running a clinic providing health care is not easy, but they started doing it because there was a need. And they started small, they started slow. The gym at Walker Middle School, they used wrestling and gymnastic mats as an exam table, piled those up. They had PVC and sheets around there, not much HIPAA protection, but that was the exam room with a little sheet between you and the next area. And they had a doctor, a nurse, and a volunteer, and that's how they started. And it kept growing because people heard about it. There was a need. People needed access to health care, and they couldn't afford it any other way. So the clinic continued to grow. This was going on for several years, and that was 2005 when it started. And it started growing a little bit more, and Salem Alliance Church decided they were going to do something similar. So they did a survey around the Grant Highland neighborhood. Went door to door, and they asked people, what do you need? And again, they thought maybe it'd be shelter, food, employment, other things, other social services. Number one thing, and this was about 2007 or so, access to health care. And they thought, darn, that's not easy, that's not simple. So they found out about the Salem Free Clinics that was already happening from West Salem Foursquare, and the two churches groups kind of merged and expanded from there. And then all of a sudden we had a more permanent facility out on Portland Road. They leased a building out there, and we're running clinics, and clinics were happening more than just once a month at the beginning. They're happening more and more. And then we evolved to 2010. And in 2010, the Broadway Commons building was completed. And I'm not sure if all of you know where that is, but it's Gaines and Hood Street on Broadway there, 4-story building, and big nice coffee house down at one end on the first floor. We're on the north end of that, and about 4,500 square feet of clinic space, all built out for the free clinic. It's modern, it's beautiful. It dignifies our patients because a lot of them come from situations where they did not have much access to health care, and if they've been in a clinic or something before, maybe it wasn't that nice or modern. Well, this is a very nice, modern facility. The patients are actually honored and dignified to go there. We have in our facility 6 exam rooms, 2 dental operatories. So it is quite a nice facility, and our volunteers love being able to serve people there. We also have 2 other locations. Mentioned the clinic in Dallas. The Polk Community Free Clinic is a satellite Salem Free Clinics. And that clinic happens at Trinity Lutheran Church. If you've been to Dallas, it's right across the street from the good old drive-in theater. Yes. And besides the Dallas clinic, we have the clinic, it's Corbin Counseling, and it's another satellite clinic of ours. And graduate students at Corbin getting their master's in counseling have an opportunity to serve uninsured patients. The Corbin professors are overseeing them, and they provide mental health counseling services to our patients. And they run virtually all year long. We just switched into a new cycle, and new students started this last week, and they'll be on for a good 6 months or more. So the counseling unit is a big part of our 3 clinics. So we have the main clinic at Broadway, the counseling center, which we just moved from the old Portland Road location to right on the campus by Broadway Commons, and then the clinic out in Dallas. We serve generally the working poor, people who make maybe a little bit too much money to qualify for the Oregon Health Plan. But they really can't afford health insurance. As we all know, health insurance is very expensive. I was just signing up with my wife's again this year. She's a teacher, so I use her health insurance. And you got to redo it, and it's like, oh, our contribution seems to go up every year. So do our deductibles, and that's only going to get worse as we read the news and see what's happening. But we also see the undocumented. Before the Affordable Care Act, maybe 20 to 25%, well, it grew each year from 2010, was about 20%, and a couple years later it was up to almost 25% Hispanic, and many of the Hispanic being Spanish-speaking. After the Affordable Care Act, that changed a lot. Since we do indeed see the undocumented, we do not ask for documentation. Word gets out in the community, the Hispanic community, that these people aren't going to turn you in or anything else. They're just there to help people. Our numbers are now more like 40% of our patients are Hispanic. So that's been a big change. We have clinics now, moving forward from once Broadway opened, we kept expanding and expanding. So now we have clinics virtually 6 days a week, not on Sunday. 3 to 4 clinics on Saturday is the average. We have generally what we call a clinic is a 4-hour window, and most of our providers, like Laura, prefer to work in the morning. So most of our clinics are in the morning. We do have some afternoon clinics. Like this afternoon, we have one with Dr. Price, who just provides general practice, and then we had a GYN specialist in too for a women's clinic. So 6 mornings a week, generally, we have clinics. Some afternoons. We have a few evening clinics, and we want to expand our afternoon and evening clinics just to be more available for people's schedules, because a lot of people work all the time, and that affects when people can go. At our clinic, we have scheduled appointments. In the old days, we would, before the Affordable Care Act, people were lined up out the door. They would come to the clinic at 5, 6 in the morning just to try to get in. That was chaos, absolute chaos, as you can imagine. So we've gone to scheduling appointments, and we've been doing that for several years now. We have electronic medical records. We've upgraded everything from the old files. We get our electronic health record free from a company called Practice Fusion, which is a very good price for a nonprofit to have. Otherwise, programs like Epic and all, I mean, I can't imagine how many millions of dollars Salem Health pays for that per year. It'd be prohibitive. Another factor that allows us to do what we do is our providers are insured for malpractice through the federal government, through the Federal Tort Claims Act, through the Health Resources Services Administration. Our providers don't have to worry about malpractice. I'm not sure if we've even had a claim. It didn't go very far if we did, because what happens instead of, if there was any problem, the provider is listed at the top. Now all of a sudden with this program, the federal government's listed at the top for a suit, and they don't lose a lot of lawsuits from what I see. Out in Polk County, at our Dallas clinic, we do still take walk-in patients. We have scheduled patients there and walk-ins. It gets a little hectic sometimes because if we only have a couple providers, we can't take every walk-in, but we do our best. And I think it's a good segue time now to talk about a story from Polk. I'm the coordinator out there as well as running the clinics in Salem. And last summer, there was a gal who came to the Polk clinic, and I get there about 6:30 in the morning to kind of set up because it's in a church and we have to do a lot of setup. We do some of it on Friday, but we're setting things up, and there was a gal waiting outside the door when we opened up, and I'm like, darn, we're going to have a bunch of walk-ins today. We only have 2 providers. It's going to be tight getting people in because it's already pretty full on the schedule. And so I kind of the intake person, so I talked to this gal and say, are you new here? Yes. And what can we see you for today? I've got to be honest, we're going to have you wait and hold, and hopefully we can get you in because we're full. It's going to be tough. Our providers, we want to get them home on Saturday afternoons because they're giving up their time. And she says, well, and she almost broke into tears right then. She says, I just heard about the clinic. I saw your sign as I was driving by. I don't have any health insurance. I don't have enough money to pay for medical care, but I've known for over a year that I have a lump on my breast. So I'm like, okay, you're in. Don't have to say any more about that. We'll get you in today. And I'll fast forward the story a little bit, but yes, indeed, we saw this patient. We referred her to Salem Cancer Institute, and I think some of the providers kind of fast-tracked that for us, which was great. She did indeed have stage 2 breast cancer. She had surgery, radiation and chemo, and several months later I talked with her on the phone, and she was just so thankful that the clinic was there because we helped start it. I mean, a free clinic, we can't do cancer surgery, we can't do things like that, but we can be the front line and refer people into the system where they can get the help, kind of like Laura was mentioning with Project Access and MedAssist earlier, providers in the community that help out. So this woman was just so thankful for the clinic. She was a whole new outlook on life because she was helpless before and hopeless, and now she was thankful that she had, when she woke up every day, she was thankful that she was alive, and last I heard she was doing well. So I'll give you a quick little patient flow for what happens at the clinic, and this will kind of spotlight a little bit of some of the volunteer opportunities that we have at our clinic. Patient comes in, similar to you going into your doctor's office. We have admitting staff and a little reception area, and we intake the patient there. It depends if they're a new patient or not, how long this takes. We get their medical history, their medication history, and these are things that people in the medical records department, medical records volunteers would help input. And we are a faith-based organization. We simply ask everyone who comes in if they'd like somebody to pray with them that day. And 35% of our patients say yes. Now, interestingly, when we have our dental extraction clinics, that percentage goes up to almost 80%. I haven't figured that one out. I don't understand it. But so we have prayer room volunteers. We have receptionists that take the phone and help out in admitting. We have medical records people. We have schedulers. These are generally areas that are non-clinical. You do not have to have a medical background to serve in those areas. And then we have, after that, the patient would be taken back by the nurse, triage nurse we call them, and they would go over the history, they would take the vital signs, and they would discuss a little bit about the chief complaint in preparation for the provider to come see the patient. We also have a role that's a clinic assistant role, and that's kind of unique, and that's, when I started volunteering, that's what I did, and I just was hooked. I just loved it. Because what our clinic assistants are is somebody who has at least some medical terminology background and that kind of thing, so they're not totally lost as we throw them in there. But the clinic assistant facilitates the patient and doctor experience. They go in the room with the provider and with the patient, and they do some of the paperwork, they do some of the follow-up, they help the provider fill out the paperwork for labs and imaging if those are ordered. Again, Laura mentioned how Salem Health pays for those kind of things because our providers need to have this information, labs and imaging, see where these patients are at to help diagnose what's going on and to best treat them. And Salem Health, through their charity care, or now they call it financial assistance program, assists our patients, and depending on their income level, most all of them do qualify for free testing like this. So the clinic assistant is in the room with the patient and provider, helping with forms, helping do follow-up visits and the scheduling like that. And it's a really unique and great role for people to do. We have had a lot of pre-med students over the years who have done that. In fact, I was just looking at a list we have. We have over 12 students right now that were pre-med, that were clinic assistant volunteers at Salem Free Clinics that are now either in med school or residency. So that's, it's a good practical experience for them, and they provide great volunteers for us. So we want to keep perpetuating that, and we've got some students from the new DO school and all too. So it's a good community relationship there. Laura mentioned MedAssist, and she kind of teased a little bit about a new program, a charitable pharmacy, and that's called Serum. We just started this last year a partnership with Serum, a charitable pharmacy that was just started in Oregon in 2016. And what Serum is a charitable pharmacy that's trying to connect got to get my numbers right again, the $5 billion of wasted prescription medications in the United States each year with the 50 million Americans who cannot afford their medications. So Serum takes unexpired, unopened medications from generally institutions like nursing homes, hospitals, clinics, that kind of thing, all certified and qualified, and they have their listing. They opened a pharmacy up in Hillsborough, nearby to the School of Pharmacy, where students at the School of Pharmacy are interning, and they double check the medications and make sure everything is up to speed. And they provide those medications to clinics like ours, safety net free clinics, community free clinics like Salem Free Clinics, at $2 a month. And these are medications that may cost $10, $20, $30, $40, $100 or more a month. EpiPens is one of the things that's been in the news and everything for how expensive they are. We just had a patient in Dallas that we hooked up with an EpiPen, potentially life-saving EpiPen, and that would normally cost hundreds and hundreds of dollars. And she was in need, and Serum had some, and we got them for $25. So it's an amazing program, and it helps our prescribers like Laura and others who are in the room with the patient. They get their test back. They know they need to get on this medication. They prescribe the medication. What if the patient can't afford it? Are they going to take it? I mean, at the end of the month, do they buy this medication, or do they put food on the table for their family? So Serum's a nice new tool that helps our providers reach out and help the patients. So a lot of people ask, well, what do we see? What kind of patients do we see? We're not an urgent care. We're not an emergency room type clinic. We see more and more a lot of chronic conditions. I mean, we still see, strep throat and influenza and different things like that coming in. But more and more, Free Clinic has turned into chronic condition management. So we see a lot of people with mental illness. We see hypertensive cases. And the third top one is diabetes. And diabetes, of course, is a ongoing progressive disease that is hard to manage. We have a wonderful relationship with Salem Health. Salem Health has a new program. They have a diabetes navigator. And Salem Health is one of our biggest sponsors each year. They support the clinic in many ways, including financially, but we also help them. It's a two-way street, because when somebody who has diabetes, for example, ends up in the emergency department and is there for a while till they stabilize and they don't have insurance, the hospital's not going to get much from them, and they don't want that person crashing into the emergency department continually. And they also want that individual to live a healthier, happier lifestyle, more just with better health, so they can be more productive. So the hospital came out with this program with a diabetes navigator, and this diabetes navigator takes these uninsured patients, schedules them right into our diabetes clinics so they can be seen. We can get medication management, be seen by a provider. We have dietitians, we have physical therapists, we have diabetic education for these patients, and it's a real win. It's a win for the patient. It's a win for the hospital because we are saving them some money, and it's a win for the community because we're keeping people healthier, and that's our ultimate goal. Got a question for you. So, how many of you have at least thought that with the Affordable Care Act, do we still need free clinics? Doesn't everybody have health insurance? I mean, all of us have thought a little bit about that probably at some point, and we were even wondering that when the Affordable Care Act was coming in, because this was all new, sweeping legislation. Let me tell you, yes, we still need a free clinic. There are 33 million Americans still who do not have health insurance. There's 32,000 individuals in Marion and Polk County who do not have any health coverage. 16% of the adults in Marion County do not have health insurance, 13% in Polk County. Before the Affordable Care Act, Salem Free Clinics was overwhelmed. We had people lined up out the door, and we were providing between 5,500 and 6,000 patient visits each year. Well, several years after the Affordable Care Act, we're still providing 5,500 patient visits each year. We're not as overwhelmed as we were. We used to have people wait 4 to 6 weeks maybe to get an appointment. Nowadays, we can usually get people in a non-interpreted appointment, usually within a week, worst case 2 weeks. For an interpreted appointment, that ranges between 2 and 4 weeks depending on time of year. Like I said, 40% of our patients are Hispanic, many of those Spanish speaking, so that has put a great demand on our interpreter needs. We do not really want individuals to come in and have family members do the interpreting. This is a medical condition. Family members are somewhat biased on what they think what's going on. We try to provide medical interpreters whenever we can for our patients. So we have hired a staff person that is the interpreter services coordinator, has mobilized a team, and now we have about 25 medically trained volunteer interpreters. So we can see our patients, but we still have a pretty good wait list for those because those appointments do take a little bit longer. There's the communication that's got to go several ways there. So we're probably as busy time-wise, probably offering more hours of clinic and more clinics than we did before the Affordable Care Act, just to see about the same number of patients that we saw before the Affordable Care Act. I think I'll talk a little bit about volunteerism again here. We have 360 active volunteers. I ran the numbers recently. We had 472 different individuals that volunteered at Salem Free Clinics last year. So that's a huge number. That is an absolutely huge number. I mean, we are a volunteer-driven organization. We do have a small staff. I'm full-time, and we have a full-time development director that helps us keep our clinic funded. But other than that, we just have a small number, about a half dozen part-time staff who average maybe 20 hours or so. So that's a lot of work that gets done thanks to our volunteers, because the staff, we certainly couldn't go very far in trying to put on 500 clinics and meet 5,500 patient needs a year just with a small staff. So our hats are off to our volunteers. We have on our website, www.Salem Free Clinics, we have volunteer applications if you happen to know of anybody who might be interested. Always looking for volunteers, both clinical licensed people and non-licensed people. I'd like to talk about dental for a little bit. Dentals have been a real challenge for us. We have a nice dental facility, like I said, 2 dental chairs. We just this last year started a preventive program, oral health prevention program, by partnership with OIT, has a bachelor's program in dental hygiene out at Chemeketa. So just in January, dental hygiene students started meeting the oral health needs of our uninsured patients as a rotation through the clinic. And that's been really great. In fact, we just met with them again, and they're starting up for the fall, and they'll be, I think October 6th is when the first group of students comes through again on rotation. And our patients are so thankful, so thankful, because a lot of these patients have not been to the dentist in an awful long time. On the other side of this, not dental hygiene, but dental, we've only been able to ever do extractions. We just do not have the time to do restorative work. So we're doing extractions just in the real tough cases. Recently, as of about 3 or 4 months ago, we had 175 individuals on our dental extraction wait list. Many of them, well, most all of them are in quite a bit of pain. Several of them had, over a dozen of them recently had infections and were ongoing treatment for that. And 3 of them needed heart surgery. And they couldn't have heart surgery until the rest of their teeth are pulled, so because of the infection risk. So it's been a real challenge. We've kind of gone another direction because we get a lot of doctors, dentists, nurse practitioners, and physician assistants, all volunteers helping us. And we have quite a few different ones working at any time. But dentists, it's harder to get them to come into our clinic and work. We have a nice facility, but they're used to their own facility and their own equipment. They're used to their own staff. So it's just harder to get them to do it. So we've kind of changed focus recently, and it seems to be working, that we have the need. There's the need. We have this huge patient wait list, all these uninsured patients who need dental services. Dentists in our community do want to help. They are compassionate, but they're not as comfortable coming to our facility. So now we're working with them, and we're scheduling our patients out into their clinics. And just as we've gone in outreach and spoken to some clinics recently, we've gotten several dentists in town and several larger clinics that are taking our uninsured patients. In fact, some of them are even now starting to do restorative work to start saving some teeth instead of just all extraction. So our wait list is down to probably around 100 right now, which is terrible, but not as terrible as it was. So we're very thankful for the dental community for stepping in that way. We've started some other new collaboratives this year. I mean, what we're finding out is the best way to reach more people, and there's a lot of people in need, as I mentioned, is to collaborate with other healthcare partners. We don't need to create the wheel. We just need to combine services. So we've done that with Serum. We've done that with the OIT program. We are working now with the Salem Cancer Institute, and we're providing screening clinics. So we've had a couple of breast and cervical cancer screening clinics, and those have been really great to partner with them. And the Cancer Institute, if we do have any findings from the screenings, they're taking the patients right in and taking care of the needs at no cost to our patients. We recently did a skin cancer screening clinic, and I was very happy we did, because I said to the provider there, I go, can you take a look at my arm? I've got this one spot there. And yeah, it was pre-cancer, so I went in and got that taken care of the other day. So I, for one, was very happy about our screening clinic, and I'm sure some of our patients that did find some interesting findings there, I think they're quite thankful too. So we're trying to continue the services that we've provided in the past. We know there's the huge need, but we're trying to add new services like prevention with oral health and with cancer screenings. We're doing more and more vaccinations. It's hard to get free vaccines. Some years there's more vaccines available than others. The county health departments have helped at times, but it depends if they have grants for it. The Walgreens is helping at times. West Salem or Northwest Human Services has helped with providing free vaccinations for us. So we're just trying to do what we can to bring healthcare access to a lot of people in need in the community. People ask us how we're funded. We are all we do not get any government money. We do apply for quite a few grants. Again, Salem Health is our biggest supporter. Kaiser Permanente is another huge one. Pacific Source, we just got a 3-year grant totaling $75,000, so that's huge. Our budget is a little over $500,000 a year, and we get probably 30% of that this year will be in grants, 20% through corporate sponsorships and fundraisers. Like a week from Saturday, we have one of our big events of the year. We have a run at Minnow Brown Park, the annual Run for Hope and Health. It's our 4th year. We have about 350 participants. There's a 10K. You're probably in the 10K, aren't you? Oh, no, ouch. Well, I guess you won't win this year. And there's a 5K and there's a 2-mile walk, and it's a fun event. And we raise quite a bit of money out of that, and then an annual luncheon we have, and sell quilt raffle tickets and ornaments and other things. But so fundraisers account for about 20% of our budget, and then the other 50% are just individual donors. We have hundreds of individual donors that believe in our cause and want to help others in the community. Salem's very generous and very good to the good work that the nonprofits are doing in town. So, question time. I hope there's a bunch of questions, because I love questions, at least the ones I can answer.
Hi, I'm Roz.
Hi, Roz.
Oregon has expanded Medicaid and is more generous than a lot of other states that I'm aware of. So could you talk a little bit more about the people that come to your clinic? How do they differ, or why are they not eligible for Medicaid? In other words, kind of compare, the averages of the groups that you see versus people that would be or are eligible for Medicaid. And I'm talking about the other 60%, not the 40% that are undocumented, but the other 60%.
Right. The other 60% are generally people who are working in just above the limitations, income limitations for Medicaid. And there's quite a few people in that boat because again, insurance is very expensive. We have a lot of people that come in that may actually qualify but didn't know how to do it. So we work on trying to resource them to get on the OHP program, because we have enough patients and enough business, as you say, already. So if anybody qualifies for that, we want them to get in there, because they can get a PCP, they can get prescription help, they can get better care than we can provide for them on a continual basis. So there's that factor. And then even on the individuals that don't qualify because they might not be documented, I just found this out not too many months ago, that somebody who gets residency, somebody who was undocumented gets residency, it's 5 years before they qualify for OHP, for example. So there's a lot of loopholes in the system, and that's where a lot of people are lying. So I hope that answers your question.
I'm going to interrupt. Another loophole is that apparently if you offers insurance, you're not eligible for spouses could get on the plan, but they had to pay. It costs a lot, and so $1,000 a month for
Right. Thank you, Laura.
All right, Irene here. This has been a very interesting presentation, really good information. But you said something that I thought was interesting, and that is before the Affordable Care Act, you were overwhelmed. But so the Affordable Care Act has helped. But so my question is, what could be done, in your opinion and experience, to improve the Affordable Care Act so that it could be more effective in our whole society?
That's a good question. Yes, the Affordable Care Act has gotten a lot of people on health insurance and has done a lot of good. Like I say, overwhelmed, 4 to 6 weeks to get an appointment, that kind of thing. We're more at a level now where we're busy, but we can handle our patient needs. To do it better, above my pay grade, I'm afraid. There are probably some different things that would help. It seems like if somebody becomes a resident, I don't know why they have to wait 5 years, but again, these are legislative and political answers that would be necessary there. But that really struck me when I found out that even if somebody has been here for a while, has been working, becomes a legal resident, yet they're not eligible for this program for 5 years, that's kind of a big loophole to me.
Hi, I'm Ingrid. What you're doing is absolutely wonderful.
Thank you.
I'm very, very impressed. Now, my question is, I've always wondered, what do homeless people do if they need medical help? Do you accept homeless people at your clinic?
Yes. We see the uninsured, and I've been on a task force or two with in relationship to the homeless population and healthcare. We estimate, and this is Salem Police and County and everybody else talking about it, estimate about 80 to 90% of the homeless do qualify and are on or at least eligible for affordable or for OHP. But there's still, and I've heard numbers between 1,000 and 2,000 homeless, and it seems like there's more all the time. So if those numbers are correct, there's still hundreds that do not have access to health care. And we do see some homeless. That isn't our primary demographic, but we do see a significant number of homeless people. There's one person in Dallas, when we send him his serum medications that usually we send to their address, he lives in his car. So he has to come into the clinic, and he goes, I'm going to be in at a certain time and check and see if my medications are in. So we do see some homeless, but it's probably less than 10% of our population. Yes.
Excuse me. Hi, this is Don. I thought sure you were going to answer her question a moment ago by suggesting something as simple as Medicare for all. Now, I assume there maybe you don't want to go there, but why not? Why have to do raffles to get basic health care for people? I don't quite understand. I don't quite understand us sometimes.
Right. Oh, I agree. The whole situation is complicated, and maybe I'm a cynic, but I guess I'm always figuring that it's going to be tough to not have some loophole somewhere. So I can hardly imagine a situation where there wasn't at least some need for a safety net clinic like the free clinic to just pick up on people who just barely do or don't qualify or are hurting economically or something. And boy, it would be better if, yes, everybody did have health care. In reality, I'm not young. I don't see it in my lifetime. Yes.
Hi, I'm Jeanette. Thank you very much for this informative presentation. I was wondering if a free clinic like this wouldn't qualify for government-supported positions under the public health, like to fund the physicians' positions or the dental positions or the mental health counseling. I know that happens in some
Right.
cases, and I'm wondering if you've looked into that or...
Yes, we have. There's what's called a federally qualified health center, FQHC. There's lots of them, like Northwest Human Services and FQHC. We have, as our board of directors, we have decided and looked into this for over a year during the Affordable Care Act time because we weren't sure what was going to happen. We didn't know if we'd have very many patients afterwards or not. And so we looked at that for quite a while. It's a lot more complicated than what we're doing now. We do have less regulations and things like that over us, which is nice. And our board ultimately decided that we still had enough demand for our needs the way we were running it, that we were going to not go into the federally qualified health center program. So we just stayed a community supported clinic is what we're called. So
my name is Bob. Everybody knows that mental health is a huge problem. And what are your resources to help those people? And I think all of us know it's limited. And you get people, elderly, going into Alzheimer's disorders, etc.
yeah, mental health is huge. It's probably our biggest presenting diagnosis that we see. And we wish we could do more, to tell you the truth. I've been on a task force that we were looking at what could the free clinic do. If we were bigger, we could be more of an urgent care type situation where somebody with a presiding condition needs immediate help. The police could bring them down and we would have providers there to help work with them. We're far from being able to do that. It's just out of the scope of what we can do. We do have some mental health nurse practitioners and a psychiatrist and prescribers that work and see patients and keep medication management going and try to keep people stabilized. The task force that I was on, we had Marion County at the table, we had law enforcement, we had several other people there. What we really pretty much decided at the time is we needed Salem Health. They're the biggest healthcare player in the community, and we didn't have a huge representation there, and so we didn't get very far on trying to tackle this animal because it's huge. It's way bigger than what we could do. But I did hear recently that Salem Health, like this new position they've had with the diabetes navigator, I think they're going to put a staff person on as a mental health navigator that would try to resource preeminent mental health needs to different community resources. So that's one step. And I know Salem Health has large grant opportunities for mental health as one of their priority areas every year. So it's a really big animal. There's no simple solution. We're interested in what little bit we can do, but it's going to take a huge collaboration of agencies to make a dent in the problem. And you're right, it's a big problem.
Any other questions? Well, thank you very much for your presentation.
Thank you.
And we have a better idea of what you offer. Thank you.